Have you or someone you know been injured at work? If so, I know how stressful that can be. What's injured? What's wrong? Am I going to lose my job? When can I go back to work? Is this ever going to get better? These are common questions that we see and hear all the time for patients that come into our clinic that we help. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and I'm fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with work-related injuries for decades now. Please remember, these videos are for informational and educational purposes only. They are not a substitute for medical or chiropractic advice, for diagnosis, or for treatment. So let's take a look at chiropractic management for work-related injuries. You know, the actual mechanism of injury can really vary. So a work-related injury is not a specific type of injury that just describes where it happened. It happened at work. Work-related injuries can be due to slips and falls. They can be repetitive in nature. They can be from lifting heavy objects. They can even be a whiplash type mechanism. You know, some people have to drive equipment for work. Some people have to drive on the freeways for work. All of these put different tissues at risk. So in order for somebody to be adequately treated for a work-related injury, the actual tissues that are the issue need to be identified, and that begins with a thorough examination. So when we see a patient here that comes in that's been injured, it all starts with a very thorough history. We start by carefully listening to the patient, listening to their story, listening to their symptoms. We do a very focused and comprehensive exam, trying to identify which tissues have been injured. If advanced imaging or X-ray imaging is needed in order to better visualize the structures that are damaged, we will order that. It's really important to start with an appropriate diagnosis, and until you really know what tissues are injured, you have a hard time expecting somebody to get better. Non-specific treatment for a non-specific injury typically gives you non-specific results. We try not to let that happen. You know, once we have a firm diagnosis, then we put together a treatment plan customized to the patient and to the injuries and to the tissues that are involved. You know, common therapies that we will use will be chiropractic adjustments, traction, dry needling, acupuncture, therapeutic exercises, therapeutic stretches, home exercises, home programs, things like that. Patients that see chiropractors for work-related injuries, based on the research, typically get out of pain faster. They typically use less medication, and they're typically less prone to having work-related injury reoccurrences. That's where the same injury will tend to flare up again down the road when they go back in and start doing their normal day-to-day activities. So if you found this video helpful, and if you know somebody or yourself is suffering from a work-related injury, we invite you to give us a call so that we can examine you and try and find relief for you. Thank you so much for watching this video. You have a lot of videos to pick from, and I'm honored that you chose this one. Until we meet again, have a blessed day.